Hi, my name is Susan Stigers. I'm with the Office of Private Health Partnerships, Information, Education, and Outreach section. This session provides updates regarding the Family Health Insurance Assistance Program, FHIAP, for our referral producers, as well as health insurance producers familiar with FHIAP. Here's the agenda. The objective of this session is to provide insurance producers with information on changes to FHIAP this year. I'm going to give you the status of FHIAP, tell you how to get your client a reservation, explain the referral process, and go over some changes in eligibility, as well as point out a few key items on the application. FHIAP provides subsidies for those who are able to get insurance through where they work, the group side. FHIAP also provides subsidies for those who cannot get insurance at work, those who need to purchase individual insurance. Currently, the side of FHIAP that provides individual insurance subsidies is full, and there is a considerable wait on the reservation list for those unable to get insurance at work. The last release of applications to those on the individual reservation list was on August 13th. There were about 2,500 FHIAP applications released to the individual reservation list, which equates to about 5,000 lives that can potentially be added on. There will probably be more applications released to those on the individual reservation list. However, there will be a more steady stream of those applications. Because of the release of applications, those of you that are referral producers will be or already have received phone calls from members needing help signing up with an insurance carrier. For those folks who have insurance available at work, the group insurance side is wide open. In fact, they can pick up an application online. The individual market applications are being mailed as openings occur. Group applications are mailed weekly. A person can go to our website and get an application there. They can either print the application and fill it out, or type into the online form and then print it. We don't have the technical ability to receive the applications via the web. Also, they must mail originals of citizenship documentation. There are a couple different ways a person gets on the reservation list. They can do it themselves, or they can have someone else do it for them, such as yourself. They can request a reservation either over the phone at the toll-free number listed here, or they can go to the home page of the FHIAP website and click on the big red Reserve a FHIAP Application button. For those that have insurance available at work, they can go ahead and fill out the application. The way to get to the application is located under that big red button. Have them click on the part that states, if you have employer-sponsored insurance group, click here. This is how the producer referral process works for those of you who are an OPHP referral producer. The member receives a FHIAP application and calls in to be connected to a producer to help them shop for insurance. Our office contacts a referral producer in their area. The referrals are given on a rotational basis within the community. The referral producer will contact the member and help them select from any of the FHIAP-approved individual market carriers. They then assist the member with their insurance application. The referral producer can also assist the member with their FHIAP application. It's very important that you have the member fill out a consent form. Without the consent form, we cannot give you any information about the status of the member's application. Here is the consent form. Highlighted here is the section where the member would check that you are the insurance agent. The consent form can also be used for anyone they want to authorize to be able to talk to us, such as a family member. Now I'll tell you about the eligibility changes. First of all, the subsidy level for children has changed. All children that are 18 and younger are now subsidized by FHIAP at 100%. For adults, the subsidy level remains the same, 50%, 70%, 90%, and 95%. The asset test has been eliminated. The intent of this is so that those saving for a child's college education or saving for a house won't be penalized because of their assets. The income level within FHIAP increased from 185% of the federal poverty level to 200%. The period of uninsurance, known as POU, has changed from 6 months to 2 months, and there are some exceptions that are new to the POU. New exceptions are for those who are newly unemployed and have lost their coverage, or for those who have lost coverage due to a reduction in hours. In other words, they may have gone from full-time to part-time and lost their benefits, and for those who have had their coverage dropped by an employer. An easy thing to keep in mind is if a person is on COBRA, this means they have access to group insurance, which has openings. And they also meet the exception to the POU. Those persons should apply to FHIAP immediately. As far as choosing insurance plans go for individual plans, FHIAP provides an approved list. And from that list, the member can choose dental and vision insurance if it's available. Remember that with a mom and pop business, they may qualify for a group plan because they fit a 2-person group. The plan must meet the FHIAP benchmark, and you can submit a producer request for benchmark analysis to see if they do. The persons themselves must meet the qualifications as well. Here is a list of the individual market carriers. Several of the insurance carriers have a dental option available: Kaiser Permanente, ODS, and Regions Blue Cross Blue Shield. Kaiser Permanente also have vision coverage available. You may see some carriers listed here that have individual dental or vision available, but are not listed as an option for dental and vision. The reason being has to do with our internal billing process. If the option for dental or vision isn't listed here, you can't add it to an individual carrier's plan. The enrollment process for an individual enrollment is as follows. The person gets on the reservation list, and when an opening occurs, they receive an application. With their application information, they receive information on receiving a free producer referral. The person submits their completed FHIAP application to us. They then receive a certificate of eligibility or letter letting them know that they can enroll into an insurance plan. They then enroll into the health plan along with your help. At about 8 months out, they are sent a redetermination packet. At that time, they can apply to FHIAP and possibly receive a full 12 months worth of subsidy. The reason that we send an application packet out at 8 months is so the person has plenty of time to get their paperwork back to us. And if they are approved for another year, then their subsidy will continue seamlessly. Here is our sample application form. This form tells step by step how to fill out the FHIAP application. It is sent along with the application, and it's also available at our website. Page 1 of the application is the member's general information, their name, their address, and so on. The member can fill out their reservation number at the top if they have one. They also need to fill out their spouse's information, even if their spouse is not applying for a subsidy. Page 2 of the application is the member's family information. Here is where the member lists citizenship information. If the person was born in Oregon, we just need to know that, and we can verify their citizenship. If the person was born outside of Oregon, they need to provide original documentation. We cannot process an application without citizenship documentation or verification of non-citizenship status. Also note that FHIAP recognizes only legal relationships, legal children, and legal marriages. If someone's separated, it needs to be a legal separation. Otherwise, that spouse must be listed on the form. Realize that FHIAP differs from the Oregon Health Plan, OHP, definitions of household. On page 3 of the application is where the income is listed. For those receiving a paycheck, we need to see the last 3 months of pay stubs. For those that are self-employed, we need to see the last 6 months of income. For those that do farming, fishing, or ranching, we need to see a full 12 months worth of income. There's additional forms in the other form packet for people that need to submit more than 3 months of income. The number one reason applications are delayed is because of lack of complete income information. So tell your clients they must look through all the sources of income listed here. If they have any of the checkbox items, we need to see it. Also, you will notice that child support is highlighted at the bottom. This is because a person paying child support can have the support deducted from their gross income. A person receiving child support will have it added to their income. The rest of page 3 talks about investments and savings. I mentioned earlier that the asset test has been eliminated. However, we still need their investments and savings information for statistical purposes only, and the application will be held up if this information is not filled out. So although it's for statistical purposes, we still need that information. Page 4 is the signature page. It's very important that both the applicant and their spouse sign this. And believe it or not, a lot of people forget to sign at the bottom, so please ensure that your client do that. The top 2 reasons an application are delayed are number 1, for the income information being incomplete, and number 2, the proof of citizenship information. Sometimes it takes a while to get a certified copy of a birth certificate. So your client might want to get that ahead of time when they're initially on the reservation list. The federal insurance coverage extension does not apply to subsidies. FHIAP dependent coverage is to age 23. Those that are age 23 and older, although they can still be on their parents' plan, need to apply for their own subsidy. The federal extension does not apply to subsidy, so they need to apply on their own FHIAP application. If you have any questions, feel free to visit us on the website at www.phiap.oregon.gov or call our toll-free number and ask for marketing. You can also send us an email at ophp.mail@state.or.us. Thank you for watching this video.